Good afternoon. Welcome to the Center for Disaster Philanthropy webinar, Funding COVID-19 Response in India, How an Urgent Crisis Affects Us All. My name is Regine Webster, Vice President of the Center for Disaster Philanthropy. CDP has convened this urgent webinar because we recognize that none of us are safe until all of us are safe. While the crisis right now and the focus of the webinar is on India, we will also highlight the crisis in the United States, Brazil, and around the world. Until herd immunity is achieved in every country through vaccines or unfortunately through exposure to the virus, we are not able to declare the pandemic over. We need to work together as a global community to address urgent solutions to this crisis. A couple of reminders just before we really dive in. First, we are recording this webinar. It will be available on our website and YouTube channel shortly after the webinar is complete. While you can access the Zoom created captions today, we'll have more accurate captions in the recording. You can also submit questions at any time using the Q&A box, and we'll answer them at the end of the panel presentation. Lastly, if you're on Twitter, please use hashtag CDP4Recovery to share and join the discussion. While we're here to talk about India and other countries affected by COVID, CDP starts all webinars with a land acknowledgement to recognize the original stewards of the land where we live and work. In the spirit of healing, I acknowledge and honor the original people of the land where I am located, now referred to as Nashville, Tennessee. This is among the homelands of the Cherokee, Chickasaw, Shawnee, and Yuchi tribal nations, and has been traversed by many native peoples who use the Natchez Trace foot trails. Despite centuries of colonial theft and violence, this is still and always will be Indigenous land. Indigenous people continue to demonstrate their innumerable talents and gifts today amid continued oppression. We're going to do things a bit differently today and start off with opening remarks from Jeremy Knundijk, the Executive Director for COVID-19 at the United States Agency for International Development, USAID, who's taking time out of an incredibly busy schedule to talk with us today. Jeremy, it's been so great to have you both as a friend and a colleague, and I'm thankful that you're here to kick off our webinar with an overview of what USAID is doing to help with the crisis in India.
Thanks so much, Regine. It's great to be talking to you again, and hi to Patty and Deepmala as well. It's great to be in touch with all of you, and really glad I could join. And apologies, I don't have more time today. We are absolutely crashing on a range of things related to India, but now also some of the wider challenges in the region. So I just want to talk a little bit about what we are doing at USAID on the India response, and then take a few questions and talk with some of your participants here. So USAID has been providing support in India. Obviously going back many decades in terms of the health partnership that we have had with the country and people of India, but also more recently over the past year and a half on the pandemic response itself. And so, beginning last year already, we were working on providing pandemic-related support in India. We sent ventilators and related technical assistance last year. We also supported UNICEF on outreach and communications messaging, and provided support to health system and hospitals through a blended finance facility that we have. We've also been working with the private sector, both in India and now increasingly with the U.S. private sector as well, on the support that they are providing. So we have we've had a strong base and a strong foundation of partnership from which we have been working, but we've really, of course, now greatly amped that up over the past couple of weeks as the situation in India has badly deteriorated. So starting a week and a half ago now, we began to dramatically ramp up our support in India, and both through our mission in India, where we've been providing support to the oxygen supply chain, and support to health facilities, both with clinical needs and other forms of financial support, but also then doing a really substantial airlift of commodities. So over the past week or so, we have sent 6 plane loads of aid supplies to India, and this has included things like oxygen cylinders, oxygen concentrators, and oxygen generating equipment, therapeutics, including 20,000 courses of remdesivir, which is one of the frontline therapeutics that India is using and has requested, 1 million rapid diagnostic tests, 2.5 million N95 masks to protect health workers and protect patients in health facilities. So a really substantial amount of work and assistance being provided through that air bridge. We're now that we've kind of sent those initial plane loads of aid as sort of a stopgap to try and address some of the immediate acute needs. We're also now trying to pivot to a more enduring footing in how we're supporting India. A couple of the biggest things that any country needs in a situation like this are to build its own, or kind of develop and pivot its own systems to be able to meet needs. Because we and the rest of the world could fly plane load after plane load of aid in, and that's happening, and that's helpful. But the game changer will be expanding the oxygen supply chain within India, and so we're working on supporting that, and kind of doing 2 tracks here, where we are providing the stopgap commodity aid, but also then trying to pivot more towards supporting capacity within India to address some of these needs on a more sustainable way. And it's a little bit like, for those of you who are familiar with humanitarian response, which is kind of the background that I originally come out of. In the early phase of a crisis, you might do water trucking to a refugee camp, but that's expensive, and it's an inefficient way of delivering water. And so it's something that you do as a quick stopgap measure, because you don't want people to die of thirst. But as quickly as possible, you also want to pivot away from water trucking onto drilling boreholes or putting in piped water systems, or things where you get a much better kind of scale of impact ratio. So that's what we're trying to support the Indians on now. We're also looking at ways to support them on the management of the crisis itself. We're encouraged to see that the Office of the Prime Minister has appointed a lead person to coordinate the handling of the crisis within India. We think that's really encouraging. Obviously, it's something that President Biden did when he came in by appointing Jeff Zients to play a sort of similar role within the U.S. system. So we think that's a really good move, a smart move, and we're looking for ways that we can support that as well. I might just pause there and take a couple of questions, but that's a quick snapshot of what we've been up to.
That's helpful, Jeremy. And for those of you listening, please, by all means, put questions in that Q&A box. I have a couple teed up, but I would be happy to feed my questions to those of you on the line. Simply put, Jeremy, what can funders and philanthropy do to help with other needs? Where should philanthropy be pitching in right now?
I think that I think there are a lot of different things that, things that the government of India has been asking for right now are heavily centered on the crisis in their hospitals. So providing clinical support in the form of, supporting forms of oxygen therapy, accessing drugs and supplies related to that. I think it is really important that, however, as much as possible, that anything that's you're seeking to ship into India just be cross-checked in advance with the Indian government and coordinated with the Indian Red Cross, which has been the delivery agent for most of this, designated by the government. And I think there's always a risk in a situation like this if too much is sent in too fast, that it can overwhelm the throughput within the system. And I think that's a risk in parts of India right now. And so just being really intentional and judicious about what to send in and how much, and then making sure that that's coordinated with counterparts in India, I think is a very important precursor to anything else.
Tommy, you spoke, that sounded like the answer was leaning more toward goods and services. What about supporting humanitarian organizations? How would you suggest that the philanthropic community dive in there?
Yeah, I think that's a great one. If you have trusted partners that you know within India, and you have confidence in, and they have the authorization and the access that they need in order to work, I think that's great. There's a ton of civil society capacity, private sector capacity in India, and so wherever possible, trying to find ways to support and build on that, I think is critically important.
Question in from Palmira Figueroa. I'm signing in from Congresswoman Jayapal, I'm sorry if I'm mispronouncing, in Seattle, Washington. We've had many inquiries of companies wanting to support sending equipment and other needs. How are the ways we can connect our constituents to the support USAID is doing?
So that's a great question. We have an email address that we've set up for our private sector engagement. That's just covid-pse@usaid.gov, and that's a good port of call, and then we can use that to make sure it's routed in the right direction. We also, on the website for the Center for International Disaster Information, CIDI, there's a list of organizations that are responding to COVID generally, and there's some information there on India as well. And of course, if the congressional office would like to reach out to AID as well through our legislative liaison office, we're happy to exchange directly too.
Yeah, and just as an aside, Jeremy, there's several folks asking if we can type those links into the chat box. So let me see if I'm going to ask one of my CDP colleagues to do that on our behalf while we're continuing to chat. Question in from Ben Smilowitz. Jeremy, are there signs that items sent to assist with the current crisis are not being released by Indian government to organizations on the ground? Any worries about the Indian government, I think is what Ben's
so the arrangement that the government of India has set up has been to position the Indian Red Cross as the delivery agent for most of the commodity aid that's coming in. And there's no question this is a significant bandwidth challenge for them, as it would be for anybody. The volumes of assistance that are now beginning to flow in are similar to what we would expect to see after other more traditional forms of disasters. And in any situation, that's a significant burden on the system. And we've seen some of the social media reporting indicating that there are challenges there. USAID is engaging with the Indian Red Cross to explore what kind of capacity support might be needed there, and so it's something we're monitoring closely. I don't think we have a whole lot more kind of insight than that at this
point. That's helpful, and I mean to your point of insight on the ground and visibility to what's happening in the day to day and the moment to the moment. Sam Nichols has a question for you, Jeremy. When COVID-19 began to affect the globe, I think many in the humanitarian community were worried about densely populated places like India. What could public donors and the philanthropic community have done to better support India to prepare for the COVID-19 pandemic?
Well, I guess I would somewhat challenge the premise of the question. I think what we know from every epidemic and pandemic response is that it's not just if it sort of falls principally on donors or international partners, it's not going to succeed. It really has to be owned by the country, and we've seen countries that receive very little international support do well if they had good policies, and we have seen countries that received a lot of international support still struggle if they didn't have good policies. And so I think that it's not the one or the other. I think it really needs to be a partnership. India is a country with a lot of capacity. We on the U.S. side, we view this really as a partnership more than it is not an aid relationship in the traditional sense. This really is a partnership, and they sent us aid last year actually during some of the challenging days in the United States. We're reciprocating that now. But fundamentally, this is a situation where, um, as every country has found, policy choices matter, and I think it is going to be important that while international support is flowing in, that there are also corresponding moves, and we're seeing some states begin to step up on putting in place lockdowns and things like that. There's a really important policy dimension to this too, that in some ways I think will be more determinative of the outcome than the actual aid distribution. And I think I've probably got time for one more, and then I'm going to have to jump on.
All right, that sounds great. I'm going to ask you a question that I'm curious about. So obviously the situation in India is dire, but as all of us, we're hearing about emerging surges in neighboring countries like Nepal, and we're also very concerned about Brazil. And we know that this is all nowhere near the end. So what's the role of the US government in responding internationally above and beyond what the lengths it's taking in India?
Yeah, and we are mounting a comprehensive global response. Obviously, India is in the spotlight right now for very understandable reasons, but we are beginning to ramp up our support and kind of build on our existing work, pandemic-related work in the surrounding countries. Nepal, as you noted, is a really particular focus and emphasis right now on that front. Brazil is still really struggling, and actually, I just prior to this got off a call related to some support that we're working to provide at the request of the Brazilian government. I think that India is in some ways a warning to us about what the potential for what the next year could look like. It was sort of easy to up until the past few months. It was kind of easy to assume or hope perhaps that things wouldn't get as bad as they've now gotten in low and lower middle income countries, for reasons of kind of demographic distribution and some other factors. I think, whether the situation in India pretty much blows all that up. Whether it's a question of the variants, whether it's some other variables that we don't fully understand. Really, I think what this tells us is that there is no country in the world that can rest comfortably and feel that it's staying out ahead of things, or afford to let its guard down until they reach a critical mass of vaccination. And so, the posture that we're taking on the United States side is a two-track approach in our strategy going forward. We are going to push really hard on global vaccination and accelerating the ability of vaccines across low-income countries. But also, in the meantime, that's going to take a while because the global supply, as of yet, is not there. It needs to be greatly expanded. And so at the same time, as we're pushing hard and expanding our work to ramp up vaccine availability, we are also going to be pushing hard on these sort of immediate term measures around reducing transmission and supporting health systems with clinical treatment, because that, frankly, is how we can all collectively save more lives in the next year. We really, there's a great phrase that a friend of mine at Resolve to Save Lives uses, Amanda McClellan, who says, we can't let ourselves be blinded by the light at the end of the tunnel. So vaccines are the light at the end of the tunnel, but they're at the end of the tunnel, and we're still in the tunnel. And so, we need to be focused on reducing transmission, addressing drivers of mortality in the meantime, while simultaneously working to ramp up vaccines as rapidly as possible.
Jeremy, one last quick question. Can you repeat the private sector engagement website address?
Yes, it's COVID, COVID -PSE, as in private sector engagement. So COVID-PSE at USAID.gov.
Awesome. Thank you so much, Jeremy, for taking time to talk with us. I know you've got to get back to helping supplies get where they're needed in the response, and just want to thank you so much for sharing your insights with us.
Happy to. Thanks for having me. It's great to talk to you.
Thanks, Jeremy. All right, now we're going to move on with the remainder of our webinar and our other amazing panelists. On the screen, you can see the number of cases in the world, the United States, in India and Brazil as of this morning, May 5th. I'm not going to read them all, but I do want to highlight a few key points. As of today, in the United States, 10 in 100 people have had the virus. Vaccination rates are for full vaccinations. Since most vaccinations require 2 shots, the number of people who have received a single vaccination may be higher. 75% vaccination rate is required as the minimum for herd immunity. In many places, because of the high youth population, this just won't be achieved until children and youth are also vaccinated. India is growing at 1 million cases. 1 million cases every 2.5 to 3 days. Brazil's death rate continues to grow quickly and includes 1,300 infants and toddlers, unlike most places where the disease has affected adults. These numbers are staggering and astounding and so tragic. CDP launched its COVID-19 response fund at the beginning of March 2020. Since that time, we've received a number of generous gifts, including a $10 million donation from Mackenzie Scott in December. We were honored to be one of her recipients. And after 10 rounds of funding, yes, 10, I'm pleased and a bit exhausted to share that as of the end of April, we've been able to make 154 grants to 143 grantees, totaling $26.6 million. You'll get to hear from one of our grantees shortly. Now I'd love to introduce the panel members who are joining us today. I'm excited to be here speaking with them today, and I'm looking forward to the information that they're going to share with us. Dr. Deepmala Malla currently serves as CARE's Vice President of Humanitarian Affairs and also has served as Regional Director for Asia. Prior to that, she served as Country Director in Iraq and South Sudan with Mercy Corps and in Uganda with Marie Stopes International. She's also held senior leadership positions in a wide range of countries with several non-governmental organizations. Dr. Ali Mokdad is Professor of Health Metric Sciences at the Institute for Health Metrics and Evaluation, IHME, and Chief Strategy Officer for Population Health at the University of Washington. Prior to IHME, Dr. Mokdad worked at the U.S. Centers for CDC, U.S. Centers for Disease Control and Prevention. He's published groundbreaking research on local level disease trends and leading risk factors for poor health. Welcome to both of you, and thank you so much for taking time away from this crisis to talk to us. Ali, I'm going to start with you. I know you've prepared some slides to highlight the extent of the crisis in India. Can you share with our audience where the pandemic stands currently?
Yes, thank you for having me. I want to talk briefly about the current situation in India. COVID-19 is the leading cause of deaths in India last week and possibly also this week. And we have seen a declining number of daily COVID cases and deaths in India from September to mid-February. And there was a sharp reversal of this trend with a dramatic rise in April. And last week, COVID-19, for example, is 3 times more compared to the highest peak when it comes to deaths. And so it's higher than ever before. That's the bottom line here. And the daily cases increased by 47%, whereas the mortality increased by 78%. Quite honestly, without drastic measures to improve the health systems and help them right now to deal with this surge by decreasing social mixing and giving a break for the hospitals and increasing the mask use, the situation in India is really looking quite grim right now. What we are monitoring right now in India is what we call effective R. When it is above 1, it means the infections will increase in the coming weeks. This is in April 15. It's above 1 in all states, 2 states almost bordering 1. The situation is very fragile everywhere in India right now. And when we monitor in India, mask wearing, and if you can move to the next slide, please. And India is not able to detect all the cases. So my colleague mentioned right now, like we have about 300,000 cases a day. We're estimating in India about 12 million cases a day, simply because the detection rate in India is about 4% right now. Not every case in India has been diagnosed and being reported. So the situation that you see in the news, 300, 350, one day over 400,000 cases, that was 15 million cases that day. And now it's about 12 million cases every day in India. Next slide, please. Mobility is decreasing in India. Do you want me to talk without?
Oh, no. Hang on, just a super quick question. India came through that first wave with about 6 million cases, but had more than that just in April alone. I'm just curious, what do you think some of the factors are contributing to the spread?
Yeah, the spread in India was several factors that led to this rapid rise. There was a false sense of security, and many people in India assumed that we are past the COVID-19 and we reached herd immunity. And mobility increased. There was a religious festivality, and there was festives, and also there was some political rallying. And unfortunately, people who are still susceptible, assuming they are not, we have seen a rise in cases. Plus, there was a new variant being introduced in India, B117 from the UK, and one homegrown B1617. Both of them are known to spread much faster, and they make the vaccines less effective. This were the reason for the largest spread in India. And of course, India is a dense population, large population. Giving a room for the virus to spread, you will see that sharp rise automatically. You have any more questions, or should I keep going?
I think I would love it if you would keep going, because I know you're going to talk about mask use.
So right now, mobility is decreasing in India, but also mask wearing was very low in India to help in reducing the spread of the virus. It was about 60%. Now it's going up to above 72%. It's still well below the 95% that we desire when we look at containing the spread of a virus in India. So mobility is now decreasing. Mask is going up. We're going in the right direction in India, but unfortunately, because of already there are so many infections in India, the infections are overwhelming the medical system.
But I just want to repeat what you just said, Ali. You're saying mobility is decreasing and mask use is increasing, correct?
Exactly. And we have seen this in every country in the world. When cases start going up, the population will react by doing the right things. And we are, as a human, everywhere, not in India, everywhere, we have not done a good job in containing this virus. We have been reacting to it. When cases go up, people are more likely to wear a mask, and they will reduce their mobility.
Okay. You've also conducted analysis on the estimated number of cases, potential deaths, and vaccines. What's the data show, and what are the takeaways for our audience?
So, as I mentioned, we are about 12 million cases right now a day, as of today, May 4th and today. So it's coming down, and will keep coming down all the way till August. And mortality will start coming down 2 weeks later. Around May 20, mortality will start coming down. Cases right now, 12 million. Mortality will peak in May 20, around 12,000 a day, and it will start coming down after that. Right now, we're looking in India, and all projections for the total deaths in India by August 1st, a little bit over 1 million deaths in India, unfortunately.
Ali, a question, I'm actually going to pull a question out of the Q&A really quickly. An anonymous attendee asked Jeremy this, but I actually think you'd be well poised. Were there any indications that the condition in India was approaching crisis levels before these last 2 weeks, or was it a surprise overnight shock?
No, there was indication that it's coming up because it started going up. And with all the mobility and all the activities that happen in India, we knew it is going to be a large spread of the virus, but not to that extent.
That's helpful. Thank you. Do you have one more slide, Ali?
I do have a little bit, one more slide.
Oh, great. Keep on going.
Okay. So right now, I'm a scientist, and we need to make sure what I'm saying right now is very sensitive. AstraZeneca is not going to help India in terms of reducing the mortality and the infection from COVID-19, simply because it's not the right vaccine for the virus mutation that's circulating in India. It's 10% effective and 6% effective in preventing infections. So that's a big concern for us. AstraZeneca It's a good vaccine, but for the old variant. It was designed for the old variants. It is not as effective against the P1, the Brazilian one, and the B1351, and of course the B1617. And the reason we are confident about that, there was clinical trials and published. And in India, if you remember, in places like Delhi, we had 60% of the population already infected, and we've seen outbreaks and a rise in mortality. So we're very much concerned about the vaccine. My recommendation is still take any vaccine available for you, even AstraZeneca. It prevents all mutations, but it's also very important for all of us to remember. So we don't create a vaccine hesitancy once we have a booster or another vaccine. People in India who took AstraZeneca and got infected, we want them to know that, yes, we are aware of it and we know about the shortfalls of AstraZeneca. These are my slides. My last slide would be, please channel all support to India. What will happen right now in India will determine the COVID-19 pandemic globally, period. We're seeing B1617 in California. We're seeing it right now spreading in Africa. And with 12 million cases, there's potential for new variants to pop up in India. It's going to be a long-term impact on health system in India. We're going to have mental health. It's going to impact the economy of India, of course, and it's going to increase the disparities that we are seeing in India and globally. We're not safe until everybody is safe, especially our friends and our colleagues and their families in India. Thank you very much.
Thank you, Ali, and we're looking forward to having some Q&A time with you in just a few short minutes, but the information and the data you just presented is just so compelling. Dr. Malla, let's turn to you next. What are you hearing from friends and family on the ground, as well as your CARE India team? And I'm curious, is the news accurately reporting the situation, or is it worse than portrayed?
Thank you very much. The situation in India, there's no shadow of doubt that India is in crisis. We have just heard credible data from Dr. Ali. However, let me say this data is dependent heavily on the testing capacity, testing facilities, and people's willingness to get tested. So many people, how many I have spoken to, the really big care team, friends, family. Normally what is happening is if one family member is positive and others are showing symptoms, the rest of the members most likely would not go for the test. So whatever we are hearing, 400,000 to 600,000 per day, let's conclude it is much, much higher. Because of reasons related to testing and logistics and capacity, and the family's willingness as well, because people are also concerned going out, getting the test, and not everybody is resourceful. This year, we are not talking that much about the migrant laborers as we talked last year, but we have huge population sizes of people with that vulnerability, and they would find it even more difficult to get correct information about their COVID status. So the situation that we are hearing, it's grim. There is a general sense of, let's say, fear, anxiety. I'm finding it really difficult or struggling to talk to anybody who is feeling some sort of hope and positivity. So it's a very grim situation on the ground, actually. And the scale really frightens. Not only community members, family members, but if you talk to local NGOs, partners, as we know, whatever is happening in India, it's very complicated, but let's say it's heavily related to governance of the pandemic. We were talking last year, will a second wave come? And now there's already discussion about a third wave, which might affect children more. Will it happen? Well, it is up to India. How we govern it, how we manage it, how we respond to it, and most importantly, or equally importantly, is the COVID appropriate behavior. So with all these various factors, there's one thing, let's say the most inspiring part in this entire story is how the community members from different sections of the society are just stepping up, doing whatever they can to help each other. So on one hand, from NGO partners, care, family, friends, we hear these stories of deaths and sadnesses, and nobody there to claim the bodies. And I'm sure you're watching the news about the crematoriums full, people
Mhm.
burning bodies in the parking lot, all that is on one side. However, you hear such positive stories where people are stepping up, helping each other to get the oxygen cylinder refilled, to transport people in whatever mode of transportation they have. That is one part which is hugely inspiring and actually makes you feel that we will get out of it in the coming months in some small way.
Tell me, Deepmala, what are CARE and CARE India doing to respond in Bihar or elsewhere in the country? Like, what specifically are you doing that's different from maybe what you were doing a month ago?
Thank you so much. So, CARE, for that question, CARE India we've been working in that country for about slightly more than 7 decades. I mean, even when I was a child, CARE had worked in India for several years. So, primarily, our biggest response is in the state of Bihar, as you have mentioned. Now, as compared to last year, our response was very focused on risk communication, information, hand washing, infection prevention, and then supporting people with food, dry rations, food packets, and a bit of livelihoods. This year, our response, or in this wave, let me put it in two broad buckets. So, one is around COVID care, which is temporary hospitals, COVID care centers, essential supplies to hospitals, including oxygen. And then the other bucket is related to supporting the ramping up of the vaccination of the COVID-19. And undercutting, of course, is driving COVID-19 appropriate behavior. So, as of now, what has happened is we already have Bihar, as you know, the capital of Bihar, which is one of the poorest and most populous states in the country. CARE India has facilitated and set up a 100-bed hospital in a sports complex. Another one 30 kilometers from Patna is about to go live. And then around 12 are in progress in different parts of the country, mostly in major cities with large populations. And the work which we are doing here is, again, because they're temporary hospitals or COVID care centers. There are some other medical facilities in collaboration with the government. We are ensuring that essential supplies are available, frontline health workers are prevented, and then we are also maximizing our efforts to smoothen the oxygen supply chain. As you would have heard, that is one of the, let's say, a really difficult area which everybody is struggling with. So that is around CARE's response in India.
So, Deepmala, we all know you work for CARE, which is one of the largest international humanitarian organizations. If you could take yourself out of your CARE role and speak as simply a humanitarian professional, how do you think that private philanthropy can help, and where do you want private philanthropy to jump in?
Okay, so thankfully you asked me to get me out of my CARE role. Had you asked me to get me out of my humanitarian personality, that would have been impossible, but this one can be tried. So let's say I feel that anybody who made a decision or a choice at some point in their lives to be humanitarians, I feel it was for this moment. We are dealing with one of the largest humanitarian emergencies, and hopefully only once in our lifetime. There are several ways which I will list where you can help CARE or other agencies like CARE. The key here is, or my biggest plea or suggestion would be around the urgency and the immediacy of it. Like, literally, as we speak, every hour, every minute is precious, because there are people who are already dependent on medical aid. So, can be supported in the following ways. CARE or other organizations. Firstly, setting up of temporary hospitals and COVID care centers is a key area, because the health system is overstretched and really needs support. The other would be supporting agencies which are helping mobilize healthcare staff members, because that is also one of the bigger gaps. I would really support and encourage support through cash rather than kind, because the local markets are functioning well. Most of the commodities are available. Yes, there are some commodities like oxygen where there is shortage, but oxygen plants are being set up. However, if there is a strong feeling or compulsion or other reasons to support in kind, then I would suggest prioritizing medical supplies or supplies related to protection of health workers, community members, and frontline NGO staff like PPE kits and masks. And I would say spread the word, keep the spotlight, because we know that the world is dealing with several crises at the same time, and even the COVID crisis is brewing in some places, in other parts of the world, like we are talking of Brazil. What we are hearing from Nepal, 40% of the tests are already coming positive. So it's really important to sort of, I would say, maintain and sustain interest. So it is about, in short, it is about support through resources, which could be cash or kind. It would urgency of it, keeping the spotlight on it, talking about it. And also, lastly, I would say, and this is not only for fundraisers or anybody who's willing to support NGO people, the numbers are high, and I think it is really time for all of us to step up and move aside from this whole debate of who is to blame and who did what, but essentially focus and support whoever is willing to respond and save lives. And I, by no means, I'm saying that accountabilities are not that important, but this is life saving. Every hour, every minute is really critical. So those would be my pleas. And again, it's all about urgency and immediacy of the matter.
Thank you so much, Deepmala. That is such a tremendous, tremendous answer, and very helpful to get us all oriented around what the needs are and to maintain that spotlight. I just would like to give you a bit of a shout out, and I'd ask all attendees to sort of put a hand up to Deepmala. It is 2 a.m. where she is right now, and I have to be honest, I do not sound as good as you at 2 a.m. really rarely. So thank you so much, Deepmala, for joining us today. We're going to move into Q&A now. So all of those questions that you've populated in the Q&A box, I'll go ahead and try to field over to Deepmala and to Ali. So question, India recently amended the Foreign Contribution Regulation Act in a manner that creates some complexity for donating cash or subgranting. How does that affect giving from the United States? And either of you can jump in.
I can start actually. So the amendments in the FCRA Act, as you know, that this affects our daily working. So there are two things here. One is advocacy with the governments at the country level to make any amendments in the regulation, which is an ongoing and longer piece of work. But right now, it is possible to send money to international organizations which have the FCRA clearance from the government, could be international or national. CARE India is an independent member of the Confederation. What we are not allowed is that once foreign currency, I'm just oversimplifying it, but once foreign currency is received by, let's say, CARE India or any other national organization, then that cannot be subgranted to another local organization. So the challenge is not so much related to sending funds from United States or any other part of the world, but it is more about working out a modality where it can reach to the agency or the body which can immediately put it to good use.
And can you keep on this same topic, Deepmala, with kind of a follow-on question to the FCRA? In the face of such a crisis, is there any way to get around FCRA regulations over foreign aid grants to community-based organizations in India? Many groups that could best use support don't have this certification.
That is true. One reality of humanitarian responses is that this is also a time where requirement for compliance and adherence to regulation also becomes very prime. And CARE, and I know several other organizations like CARE would adhere to the regulations and the guidelines put by the government, because I would not suggest that while trying to shorten one process, we end up into a much longer process where it becomes much more difficult. So having the paperwork complete and ready, making sure that we are totally transparent around the funding received and how it is spent would be more efficient in the environment that we have and the urgencies that we are dealing with.
Makes sense. I know it's tricky, and I know there's other questions here about being able to sub-grant or not, but Deepmala, I think you've given us a really tremendous answer. Ali, question for you. Recognizing that you are really so focused on the data and looking at the trend lines, where would you like private philanthropy to play a role in continued research, in continued development of data and analysis around the pandemic in India as well as in other countries?
The data quality for us has been an issue in many countries simply because of lack of testing and delay in reporting. Addressing them will help a lot, but the most important part right now in many countries is to understand how many people have been infected already, and looking at seroprevalence surveys and also at sequencing the virus to know what variants are circulating. So if you could help in donating any country, including India, make sure we're testing enough, we're sequencing, and we know what's the percent of people who have been infected through seroprevalence survey. May I say something? You asked me a question about, did we expect this to happen in India?
Oh, yeah.
I would like to focus on the positive. Right now, we're dealing in India with a response in emergency and refugee health, and I've done a lot of work emergency and refugee health when I was at CDC. There is also a recovery phase, and I would like the listeners today, all the donors, to remember that. Please don't leave India out of your mind and your donations once the cases are low. There is a long road ahead in India for rebuilding, and the recovery phase is as important as the response phase. So please, all of you, keep that in mind. Over.
And Ali, that's super, and links directly to my next question. You know, you and Jeremy and Deepmala have talked about India, but we also have a shared concern about similar crises coming in Nepal and Brazil. So, question, if you could talk a little bit about Nepal and Brazil, and then Alicia Simmons is curious about if there's any specific concern related to Sri Lanka.
In our data, we are monitoring the situation on the neighbors of India, and we've seen a rise in Pakistan, Bangladesh, Nepal. It started to decline in Pakistan and in Bangladesh. Iran went up and started to decline. Nepal is still going up. Brazil, the situation is getting better. Cases are declining, but still they are overwhelmed. And Brazil, the concern is totally different. They're heading into their high season because they're going into their winter in the southern hemisphere. So the concern of Brazil is going to be more so in the coming months than everywhere else in the world. I hope I answered all your questions.
No, you did. You did great. Do you have anything to add, Deepmala, to India, Nepal, Sri Lanka, Brazil, elsewhere? Deepmala, you might be on mute, so if you're coming off mute, I'll go ahead and ask Ali another question. What can you tell us about herd immunity? Like, what are you thinking in India or elsewhere about the length of time to achieve herd immunity? Herd immunity.
Unfortunately, let me talk about the US first, since all of us are in the US. We don't expect to reach herd immunity in the US simply because people are not willing to take the vaccine. And the vaccine, unfortunately, is only right now authorized for adults. So take a country like India. Even if you vaccinate everybody who's eligible in India, the children are not eligible, less than 16. And that will create a problem in terms of securing a herd immunity and them going back to classes. And herd immunity is going to be a catch-up game with the new variants because, quite honestly, the vaccines are less effective against the new variants. And then we will be playing a catch-up game. We need a booster depending on what variants are circulating. I'm not that optimistic about herd immunity in a way in the short run, not the 6 months and 1 year. But I need to remind everybody, mask wearing at 95% will provide us a great immunity and will control all of us, every country in the world was able to control COVID-19 before the vaccines using masks and social distancing measures. We can do it, but it depends on our behaviors as we vaccinate our way out of it. Vaccines are not going to be the only answer here. Over.
Thank you, Ali. Deepmala, I know we lost you, and I'm so glad that you're back on. I was hoping to get your insight on the question of how the crisis is going to progress, specifically in Nepal, potentially in Sri Lanka, and also in Brazil, if you have any insights into South America.
Thank you, and sorry about that. I think I'll build on my response around what Dr. Mokhadad just said. Again, I'm not at all thinking that the numbers would fall at a pace as rapid as which they rose. It is going to be slow. It's going to take, it rose fast, but it is really going to be slower. One of the factors, several factors which will really determine how it progresses in the coming times in India, other neighboring countries, Nepal, where we are already seeing, is that control lockdown, that is one story. But if the vaccine game is not at the same level, the combination is not there, it is difficult. And now again, we have complexities related to variants and the efficacy of the vaccine. The other thing is, in many of these countries, especially India, the measures which are put for controlling, especially like several of the virologists, epidemiologists are of the opinion that any gathering, especially indoor, they should be immediately curbed, closed. But implementation, governance, adherence, that remains a challenge in India. We all have been reading and hearing reportage, media interviews where people are blaming the system or whoever. However, the citizens and every single person have accountability as well. I was there around Diwali time, and people were even laughing about the mask or whoever is wearing a mask. So how it will go forward, a lot depends on us. Let's say it is not going to be easy. This is a long one.
And Deepmala, another question for you. Why is it important to work with organizations that are embedded in the country, whether or not local or NGO? And again, I have a list that with FCRA taken into account.
If you want, let's say, why is it important? Several reasons. One, stronger understanding of the context. Second, existing relationships with and knowledge about the local health system, the local vendors, the local supply chain system, how things will move here. Navigating the complexities of bureaucracy, because bureaucracy is one matter, the another matter is interpretation. And then, as a part of the grand bargain to which most of us are committed to, I hope everybody is, we have committed to locally led and globally connected. And sometimes, even things like understanding of the cultural context, the language, it does play a really big role. So the local actors or the people who are on ground, international, national, they have a much better understanding of what is needed, what would work, and things would move fast. So even with the FCRA complications, even if we think that there is no way, either national or international, local or outsider, the regulation, everybody will have to deal with it. So it's not the case that we can work around the FCRA if we do not work with local organizations. That is not the case. That is the modality, the mechanism to work in India. So longer term, we do advocacy and we work if it can be amended. But right now we have to find solution through that, empower local leaders. And I would say when we say local, women, trust them. We always think of women as victims or receivers of aid. No, no, no. They are the first responders. In every emergency, women are the first responders. Let's trust them. Let's give decision making and money in their hands. That is one of the sure ways to get out of this crisis, like any other, much faster.
That is so helpful. All right, Ali and Deepmala, that is all the time we have for questions today. But as we begin to wrap up, I want to summarize some of the discussion and provide the audience with some key takeaways from our conversation. Localization and prioritizing community knowledge is critical. It's just not appropriate to predetermine a community's needs and the necessary solutions from afar. Trusting those closest to the crisis to provide an accurate diagnosis and guide the response is a good start to developing a localized humanitarian agenda. Secondly, this is a change in crisis. If you're a funder overseas, let your grantees manage the funds in response to what they're seeing on the ground. As it changes, so should allocation of the dollars. And we know this, we're all in this together. India's in a dire situation, hence the world is too. We are not safe in the United States until everyone across the globe is safe. The longer this lasts, the greater the risk for variants. When a virus has time to mutate, it can replicate in ways that vaccines can't protect us against. It's important to deal with it as quickly as possible. Fund non-governmental organizations that have a long-standing presence on the ground. This last piece is incredibly important to CDP. This could be a local NGO or an international NGO that have built relationships with local actors. India in particular, as we've discussed on a couple of questions already, has very specific rules about foreign giving, but funding a 501c3 that is strongly rooted in local work and hiring can help you navigate those regulations. As our panelists have shared, there's going to be ongoing needs for assistance with recovery efforts for years to come. CDP has many resources, including several funds devoted to disaster philanthropy that can assist you. Our issue insights provide an introductory look at disasters and responses. We have recordings of past webinars that you can view. Our disaster profiles page provides regular information about the impact of a disaster and the needs of the community to inform philanthropy on how they can help. Our staff are always available to provide guidance. You can find more information about our work at disasterphilanthropy.org. And to those of you who may be planning disaster response funding, CDP has many additional resources and information in our disaster philanthropy playbook. You can find that at disasterplaybook.org. So in order to respect everyone's time and keep this to an hour, unfortunately, this is all the time we have for today's webinar. To all those listening to the webinar who have friends, families, and colleagues on the ground in India, Brazil, Nepal, and other places in the United States that have been hard hit by COVID, our thoughts are with you. Thank you, Jeremy, Deepmala, and Ali for taking the time to share your insights with us. And if you have any questions or thoughts that were not addressed during today's webinar, you can email them to my colleague Tanya at tanya.gulliver-garcia@disasterphilanthropy.org. Thank you all so much and have a great afternoon.